Patients undergoing radiation therapy may have similar side effects of those undergoing chemotherapy. However, radiation therapy is delivered, of course, in a different means. The very first appointment that a patient has for radiation therapy can be a very long day for them. They do what is called simulation. They place the patient on a table and take pictures similar to a CT scan so that they can accurately pinpoint the area that needs radiation therapy. And this can take at least an hour or so. After that day, the radiation therapy appointments are pretty short. They may actually only be on the table for a matter of seconds to minutes to receive their radiation therapy, and then they are allowed to go. They will probably see a nurse or a doctor with each visit just to see how things are going. Depending on the area that's being radiated, a patient may experience fatigue. They may experience low red blood counts and low platelet counts, low white blood cell counts. They may also experience skin irritation over the area that's been radiated. This may be similar to the irritation that you experience when you're sunburned. Most of the time, I would say that the patients experience maybe a deep reddening to the skin, maybe to a second-degree sunburn, a severe sunburn. Many lung patients receive side effects to their esophagus because of the close proximity of the tumor to the esophagus. This can cause a lot of inflammation to the esophagus and make it very difficult to eat, difficult to swallow. And again, we would be dealing with the patient experiencing weight loss, which makes you weak also. So there would be a combination of fatigue and weakness. There are, again, medications that we can give the patients to help them not to get in any bad situation where they're just not eating or taking anything in at all. Many of the drugs that we give women, especially the young women, may put them into a menopausal state. There's a lot of emotion that comes with that. If you have a healthy woman who's having regular cycles and their hormone levels are doing what they're supposed to do, and all of a sudden we give them drugs that wipe them out, and so that the levels fall, there's a lot of changes there, a lot of changes emotionally that are hard to get used to. If there are women that have experienced surgery anywhere on their body, if they've lost a breast, their body image is very, very distorted, not only in how they view themselves, but maybe how they perceive others view them. A side effect that affects both men and women that can be a very emotional thing is hair loss. So when the hair starts falling out and they are bald and it has changed their look so dramatically, they feel very self-conscious about that. But it can fall out anywhere from a week to several weeks after their chemotherapy has started in. And though some of it may start to come back in as a little fuzz, it really won't come back in as good growth until they've stopped chemotherapy. I think overall, in a patient's performance at work, you may see that a patient may have to go on part-time because of the fatigue they experience. That can be a big factor in maintaining a consistent work attendance. I've known many patients that can work all the way through their chemotherapy. Many times, though, they'll miss a day here and there just because of nausea or fatigue. Typically, if a patient's going to experience nausea and vomiting, it's usually within 2 or 3 days after their treatment. Those are the days where they feel it the worst or it hits them the hardest, and then they start to feel better after that. So they may be missing a day here and there. If they're getting radiation therapy, they may be missing a short period of time during the day, every day, because radiation therapy is delivered on a Monday through Friday schedule, sometimes up to 5 and 6 weeks in a row. An employer should not have the same set of expectations for every person in their employment that is experiencing cancer. The fatigue will be different, the nausea will be different, just the environment and the whole treatment experience is so individualized. So it's good to keep in mind that we must listen to our employees and take them at their word. And if they need the time, if they aren't feeling well, that we need to respect that. We are all different, and our experiences will be different.